Hello, it's Dr. Eloise Matthews from Pinnacle Sports Physicians. Today I wanted to discuss relative energy deficiency in sport, otherwise known as RED-ES. RED-ES is impaired physiological functioning due to underlying hormonal disturbance. The hormonal disturbance is caused by a relative deficiency in energy availability. As energy availability reduces below 30 kilocalories per kilogram of fat-free mass per day, a number of hormonal changes occur. We see the T3 reduce, as does the IGF-1. There is a reduction in bone protein synthesis and mineralization. These effects can occur within 5 days of energy deficiency and can occur in the absence of a change to estrogen levels. So who gets RED-ES? Both males and females are affected, and there was one study of elite cyclists showing up to 50% of the group were suffering from relative energy deficiency, so it certainly is common in both these populations. We see it in a range of age groups, and we also see it in a range of competitive levels, from the recreational athlete through to the elite. The symptoms of relative energy deficiency in sport can be subtle, and it can be an easy diagnosis to miss. You need to have a think about the athlete that presents with multiple injuries, the athlete that presents with multiple illnesses, or seems to have a prolonged recovery from any viral illness that the rest of the team recovers from quickly. Those athletes that are struggling to recover from a particular training stimulus or are dropping in terms of their performance, you need to think about what may be underlying. You also need to think about it in those who have psychological symptoms. So they may have low or irritable mood. They may be struggling to get on in a team environment. And the most obvious or well-known symptom is that of menstrual dysfunction in females. So females may either lose their periods or have a prolonged cycle duration, so they have fewer periods per year. The last group of symptoms are gastrointestinal symptoms such as bloating, constipation and abdominal pain. From a health point of view, there are multiple issues with RED-ES. In the long term, bone health is affected, which leads to osteopenia or osteoporosis. Fertility can also be affected, leading to subfertility. There are multiple psychological effects of this syndrome that lead to social isolation, social misunderstanding and difficulties within the team environment. It can lead to long life habits that are negative in terms of body image and self-perception. Iron deficiency is part of this syndrome. It can worsen the hypometabolic state, and this is an interaction we see via thyroid hormone. Energy deficiency can be promoted via ATP, and this leads to further impairment of bone health. Bone health is time critical, so we accrue 90% of our bone mass by 19 to 20 years of age, depending on our sex. This is why it's really important to pick up this syndrome early. It is much easier to manage early rather than waiting until there are health complications. When patients are on oral contraceptive pill, this means that their withdrawal bleed is due to the tablet they are taking. This then means you can't use the menstrual cycle as a marker of energy deficiency. It no longer represents anything to do with the energy state of the individual. There are significant performance effects as well as health effects for RED-ES. Here are some of them. I think it's important to discuss this with your patient, and it certainly gives a lot of buy-in and a lot of understanding to what has been going on with their bodies. This is a diagnosis of exclusion, and for that reason I think it is important that a doctor makes this diagnosis. We will arrange an array of blood tests to make sure there is not any other cause for their presentation, and we may also arrange tests such as bone density or ECGs depending on the individual we have in front of us. In terms of management, we need a multidisciplinary team to look after these individuals. Intake should be increased, and initially we aim for somewhere between 300 and 600 kilocalories of increased energy intake per day. Sarah Widowson, who is a dietitian, will discuss this further in part 2 of this education session. Expenditure should be reduced, so training plans need to be reviewed. Bone health should be optimised with some resistance training of 2 to 3 sessions per week. From a psychological point of view, we need a psych practitioner who has a good experience with RED-ES involved in care. In summary, you need to have a high level of suspicion for RED-ES in the patients you are seeing. They're very unlikely to turn up and say, "Hi, I think I've got RED-ES," but much more likely to present with the vague groups of symptoms that I described earlier. And if you think there is an underlying RED-ES picture, please refer early. I hope that's really helpful, and I hope you look forward to part 2 from our dietitian Sarah Wooduson, which will be coming shortly. See you later, guys.